Lindsay, thank you. Kind of the unofficial end of summer this weekend, the Labor Day weekend. We're used to barbecues, parties, maybe even a trip to the lake, maybe to wrap up before school starts.
But just like seemingly everything else, this Labor Day will also be very different. So this morning, we're once again joined live with Dr. Dana Hawkinson from the University of Kansas Health System. So, Doctor, since this pandemic started, we have been through Memorial Day, we've been through 4th of July. What lessons did we learn from what happened those holidays and shortly after? What mistakes did we make that we can change this holiday weekend to slow down that spread of COVID-19?
Yeah, it's the same message. You know, we did see surges after Memorial Day, after 4th of July. Now, it wasn't 2 weeks later. It was more like 4 to 5 to 6 weeks later as it starts to spread more. We understand that the disease is out there more. We understand that in our community, there are a lot of cases every day. This past week, the 7-day running average was more than it was a week ago or 2 weeks ago. So we understand that the disease is out there. The biggest thing we can do is continue to meet in small groups. Do not meet in large groups. I know that's difficult to do, and we want to celebrate and be with friends and be with family. But meeting in smaller groups, smaller is better, less than 10 is better. Of course, the physical distancing, and of course, mask wearing when you are in those enclosed spaces, when you are around other people who are not in your bubble, even if that's outside, because you can't always control your 6 feet or 8 feet of environment, especially when you are in crowds of larger crowds of people.
Dr. Hawkinson, let's fast forward a little bit to November now for another holiday, because we're starting to think about holiday season. Right after school starts and we start to think about, okay, what are we going to do for Halloween, Thanksgiving, Christmas, and Hanukkah, and all the different holidays that are going on through the fall. Some public health experts have already said families need to start planning for a virtual Thanksgiving. The idea of that bums me and a lot of other people out. Yeah. Do you think that's something we should just get used to right now, as that's probably going to be more likely than a whole big family gathering?
You know, it always goes back to individual risk. I certainly wouldn't disagree with that. We always have to understand who is in your bubble. You know, if you know that your parents or your brothers or sisters or their family and their bubble is good, but as you get more and more people who are not in your immediate household, you really can't control what those other people are doing. So certainly preparing to do the virtual meetings is a good idea. You know, we have to understand as it gets colder too, in October, in November, in December, we aren't going to be able to be doing things outdoors. Certainly in the summer it's been good, because even though there have been large gatherings, I think a lot of those have been outdoors. Now as we move indoors to enclosed spaces, to less air turbulence and airflow, and if people from other households or other bubbles are getting together, whether that's at bars or party or other get-togethers, they will have an increased chance of spreading coronavirus around to each other and then to people who they come into contact later on.
Doctor, people are still trying to find out the best, most comfortable option for face coverings, and we wanted to ask you about this video from Florida Atlantic University getting a lot of attention online. It uses lasers to illuminate the path of coughs when a person is wearing a face shield, and then also when a person is wearing a valved mask. And in the video, you can see it can be really scary to see just how far those particles spread, specifically the face shields when you're not wearing a mask underneath, which is something that I know a lot of us have seen people doing. You have the face shield on, you're not wearing a mask. What is your take on that?
Yeah, I think that's a good video. We are starting to learn more. You know, one of the silver linings of COVID is there is more information, more experiments being put out there for the general public. The face shield, I think, is a good idea. However, it needs to be coupled with a face mask, with a cloth face mask or a surgical mask. That is going to be important. World Health Organization even came out and said a face shield does not constitute barrier protection. And again, from day one, that's what we have talked about. The face mask is for barrier protection, so that we can protect other people from you if you do not know you are sick and spreading the disease. Now, the face mask will also offer some protection for you, the wearer, but mostly it's for the barrier protection. And they have come out and said that just a face shield alone does not constitute barrier protection. So really the cloth face mask or the surgical face mask is needed in addition to the face shield.
Feels like something we've been preaching for months now, but it continues to be the same every day. We appreciate your information as always, Dr. Hawkinson. We'll see you next week. Thank you so much.
All right. Thank
Dr.
you.
Hawkinson joins us live right here on 41 Action News every Tuesday and Thursday morning at 6:30. So if you've got a question about the pandemic, reach out to us on social media or by email. We'd love to ask Dr. Hawk on air. We'll be back.